I'm Kate Chaplinsky for the HAN Network, and May is Mental Health Awareness Month. And we're looking to get a conversation started and raise some awareness here at Silver Hill Hospital in New Canaan. Right now, I'm joined by Dr. Seddon Savage, who is the medical director for the Chronic Pain and Recovery Center. Dr. Savage, thanks for joining us today.
Well, thank you so much, Kate, for coming to visit us and for your interest in these very important issues.
And today we're going to be talking about treatment options for chronic pain. And first, I just want to ask, what is chronic pain?
That's a more complicated question than you might think. First, it's helpful, I think, to talk about what pain is, because pain is really a complex experience and it's a highly personal experience, and it can be many different things. So pain is a protective sensation that we have that lets our body know when harm may befall us, when we're being injured or something's threatening to injure us. So that's the most common definition of pain, and that's what happens in acute pain. You get cut or you have an injury, you break a bone, you have surgery and you hurt afterwards. That's acute pain. But chronic pain can be much more complicated. Sometimes chronic pain occurs because there's an ongoing process in the body, an inflammation or an ongoing injury. But often, chronic pain happens after everything's healed. But the nervous system, the neural pathways that normally signal acute pain remain active. And that can happen for a variety of reasons. And we call that neuropathic pain. So chronic pain can either be because of a ongoing injury or irritation to the body. It can be because of purely neuropathic or changes in the nervous system, or it can be due to a combination of both. Then we're learning more and more about chronic pain, the neurobiology of chronic pain, and we understand that at every point along the way in the transmission of that pain signal from the tissue through the peripheral nerves to the spinal cord, up the spinal cord to the brain, and then through many networks in the brain, things can happen that change that signal of pain. It can amplify the pain signal and it can reduce the pain signal. And those things can be physical things such as other sensations that are transmitted through the body. It can be the presence of certain medications in the body, the presence of or lack of enough oxygen, or the chemical balance in the body can all change that signal. Very importantly, thoughts, feelings, memories, and other things can also play in to the final perception that the brain has of pain. So it's complicated.
It is. And in talking about chronic pain, you hear a lot about pain management. Mm-hmm. What is that?
Well, pain management can be many, many different things. So when I think about treating pain, first of all, fundamental to determining a treatment plan for an individual patient is identifying the components of that person's experience of pain. What are the physiologic processes that are generating the pain? What are the filters through which that person's experiencing the pain? What are their feelings? What's their general physical condition? Are they sleeping well? How are their relationships? How are they moving? What's their posture like? Physical things and psychobehavioral things are very important. So once we understand the experience of pain, we need to address the pain comprehensively. Now, if it's a simple acute pain, you sprain your ankle, you may need some ice packs and some ibuprofen for a couple of days. If it's a more serious and complicated and persistent pain, you may begin to need exercise. You may need to manage your stress better, because we know that stress increases the experience of pain. There are lots of different things, different programs that we might put together to treat an individual's pain. But when we think about pain treatments, I tend to think about them in four broad categories. And whether it's acute pain or chronic pain, it's helpful to consider what from each category might be helpful. So probably medications are what we most commonly use, and there are many different types of medications for pain. There are, as we mentioned earlier, anti-inflammatory medications such as ibuprofen or acetaminophen, mild analgesic medications. There are strong medications for severe pain, like opioid medications. things like oxycodone or morphine, which are quite potent medications. But we also, for nerve pain, that we use anti-seizure medications sometimes, because that nerve pain, very similar to seizures in the brain that cause epileptic type events, there can be short circuits in the nervous system. So we'll use those anti-seizure medications very effectively. Sometimes antidepressant medications, because of their effects on neurotransmitters, can be very helpful in certain type of nerve pain. There are topical agents that we can apply. There are at least 3 different mechanisms by which those work, and for some conditions they can be effective. So medications are number one. There are a number of procedures that can be done to get at that tissue generator of pain, or sometimes to quiet nerves down, often called nerve blocks. There are trigger point injections, there are steroid injections. Procedures, sometimes implanted stimulators, can be helpful. So medications, procedures, and then very important, particularly in chronic pain, are psychobehavioral interventions and physical therapeutic interventions.
And I know a lot of times when we hear about chronic pain, we think about, more opioid type medications, but you're saying there's other options, things people can do.
Oh, there are many other options. And in fact, the more experience we have with opioids, the more respect we have for both their potency and their value, but also the fact that we need to use them very carefully. And they are really rarely a first-line intervention for chronic pain. Much chronic pain can be managed with other medications, procedures, and very importantly, physical therapeutic and psychobehavioral interventions. So if I could just say a few words about those latter 2 categories, because really, if we think about chronic pain as a chronic medical condition, not unlike diabetes, heart disease, asthma, other things that we treat aggressively, sometimes with medications and procedures. But we know for all those chronic conditions, if the patient is actively engaged in self-care, for example, for diabetes, perhaps it's diet and exercise that are important. For heart disease, similarly, diet and exercise can be important. Stress management can be very important. It's just the same for chronic pain. Though there may be a role in patients for particular medications, including in some patients opioid medications, if those are prescribed and the other interventions are applied in a context of self-care, what can I do? What increases my pain? What decreases my pain? How can I manage to keep it at the lowest level possible and engage in my life? Do things that I enjoy, participate in activities that are important to me, the outcomes will be much better.
Now let's talk a little bit about addiction and some of the medications that can be prescribed and just the pathway to that and how that can happen.
Well, addiction, for many pain interventions, addiction is not really an issue. When we're talking about physical therapy or meditation or CBT or medications such as anticonvulsants, anti-seizure medications, antidepressants, nonsteroidal anti-inflammatories, though people can become psychologically dependent on almost anything, addiction per se is not something we usually consider in the context of those interventions. However, when we talk about opioids or even some muscle relaxants, there is a propensity for these medications to produce what medically we call reward. Most people would think of it as a high or euphoria. So these medications can, in some patients, cause a high or reward. And in people with a vulnerability to the development of addiction, they can go on to be associated with an addiction. Addiction to opioids is a particularly problematic, all addiction is a challenge for the individual, but it can occur very rapidly in vulnerable persons, and it also opioids can be associated with overdose deaths, and not only in people who are addicted. So opioids slow the breathing. And over time, most people become tolerant to that. So you can use them if you start at low doses and increase slowly. They can be used safely. But if you use a dose that you're not accustomed to or a much higher dose than is recommended, it can slow the breathing and ultimately stop breathing, which leads to lack of oxygen in the heart, which can lead to cardiac arrest and death. So in persons who develop, and that can happen with people just taking in a mistaken dose, or sometimes people will use an opioid experimentally to get high, and it can happen on the first time if the dose is too high. But it's more common in people who've developed addiction, of course, because they're working to create more and more of a high, and they may be using them more frequently. So tragically, we're seeing rising opioid-associated deaths all over the country, and particularly in New England. In many places, but New England is one of the hot spots for that.
Now, if someone is suffering from chronic pain, what do you suggest they do in looking for a physician to help treat them?
So I think in seeking care for any chronic medical problem, it's very important to work with your primary care director, primary care provider. It's a director of sorts, I guess. Primary care provider, whether it's a physician, nurse practitioner, or a physician's assistant. I think we all need to have somebody who we really trust and can rely on to coordinate our care. So, and then hopefully your primary care doctor will know who the good pain providers are in a particular community. You want to be able to engage with providers who will look very comprehensively at your particular pain problem, help diagnose the components that are contributing to your pain, and help you manage them. And often that will be a multifaceted treatment. Medications may be helpful, but you may also need to engage in exercise. One of the strategies that's clearly becoming very important in pain management and in management of many chronic conditions is deep relaxation or meditation, a form of stress management. But we're beginning to see that there's actually a neurobiologic effect on the body and on the central nervous system and the peripheral nervous system through these techniques. So exercise, stress management, deep relaxation, meditation, very strategically applied use of particular medications, the right medications for your particular problem, and interventions from time to time can be very helpful as well, those nerve blocks or trigger point injections, other types of things. I would just add that there are specialized pain medicine practitioners. Many of these are board certified, and if they have board certification, they should be trained in a comprehensive multimodal approach. Often we find that particular clinics will only offer one modality. So if you're seeking a pain treatment provider, it's helpful to call ahead and say, well, what approaches do you use? And listen carefully to hear if they seem to provide multiple different approaches, because you need to draw on those as may be helpful for your particular problem.
Now, Dr. Savage, anything that patients shouldn't do when they're suffering from chronic pain, anything you suggest they stay away from?
Well, I think it's important to remain engaged in things that you enjoy, remain engaged with family and friends, to take care of yourself, to get up and be active, to keep moving. So the opposite of that is what I'd avoid. And unfortunately, it's really a reflex. When you have pain, it can be a reflex to just stop moving. You're really frightened that you're going to hurt yourself more. And so you can become very deconditioned and just very inhibited about moving. It's also not unusual for people to disengage from their families. They don't want to be a burden, so they kind of withdraw, and they feel that they're not interacting with people in the same way, so they may avoid getting together with friends and may feel that they can't be involved in the things that they enjoy. But it's important not to withdraw and to not give up the things that are important to you, that give your life meaning and pleasure. You may have to find new ways of doing those things, and you may have to change somewhat in the way you relate to people or the way you move and the type of exercise you do, but keep moving, keep engaged.
Dr. Savage, thank you so much. This has been really enlightening.
Okay. I hope it's been helpful, and we're happy to help at any time.
Well, thank you so much. All right. Well, for more on our partnership with Silver Hill Hospital, you can check HAN.network all this month. We'll see you next time.